if you've been watching, you know we're talking to Michelle Turner. We're talking about April is Autism Month. Graham is her son, and he has autism, and we're talking about a procedure, a method that does alleviate some of the signs of autism, makes them more mobile. And Michelle, what you're doing right now is something you learned. Well, you went to California initially.
Correct. I went to California with Graham. He wasn't walking properly. He was still nonverbal. He just needed help. And in California, they do an intensive where if you go for 5 days, you get 10 lessons.
And it is called?
The Anapa Nail Method.
Okay.
And I actually worked with Anat and the people there at the time. And his transformation in just days was just incredible. And my husband, like I said, just said, you're going to learn how to do this. So
now, what is it you're actually doing right now?
I'm working directly with the skeletal system. I'm looking to see how he's moving, in particular with this and his left shoulder. Graham used to have an IV port in his left shoulder, so that's something I like to work on with him, because he was very protective for a while because he didn't like his IVs. And that's from the no immune system. So it's something, and so what I'm looking for is just his response of the back. It's not a forced thing, but I'm looking for him to play at a much more organized level versus just slouched and not being aware. And again, by just me touching him, gives him awareness of that there's actually someone else around there.
So is it the touch, or are you manipulating muscles? What are you actually doing?
It's a touch, but it's directly with the skeletal system and the central nervous system. It's not muscle-based. When you work with someone's muscle, that does not affect their brain for learning. Our skeletal system is what affects the brain for learning.
Are these treatments required like daily? They must be continued.
Actually, no. What we found works best is to do an intensive, and literally you don't have to go back for 2 to 3 months after just a week of lessons. And then people that see me locally just come once a week like they would for just any other normal OT or PT therapy. And
how many of your clients bring their children or are autism clients?
Most of the clients are because of autism, and or CP is another big one where this really is very helpful. Cerebral palsy, sorry.
Okay. Now, this can be used obviously for movement and pain without any type of disease.
Oh, correct. I mean, I could make you a whole new person. It's just, you could be completely typical. It doesn't mean I might discover you've never crawled or something like that. And I would just work on your system just to, again, organize it just at a higher level, just to relieve daily stresses, or, it doesn't have to be because of trauma.
When you're doing this, what is being eliminated from the body? What is happening in the body right now?
Okay, what is happening from the body, what I'm looking for is when I bring him this way, his pelvis is responsive, meaning this area of his hip, I'm looking for it to come up, which it's starting to. And now that it's doing that, the knee's coming up. Same thing if I go to this side, I'm just looking, and you can start to see where he's starting to actually sit up straighter. And now, because he's sitting up straighter, the way he's reaching, now his head's not as floppy, just because I've started the stimulus, and before, if you just kind of looked, he was sort of.
In general, for a child with autism that you might be working with, what benefits do you see, or what benefits might that parent expect?
Before I started my training, Graham's goal was a one-word self-help. He could not, at 4 years old, could not say mom. And he was at the Foundation for the Blind. He was really in not great shape. When I finished my training now, Graham is first grade, he's mainstreamed. I don't know how you would get those kind of results with just typical therapies, and he does 100% on his phonograms, 100% on his spelling. He still needs to work on social communication. So, I mean, there's things that I definitely need to work on with him. I don't know still if he's going to say, hey, Steve, what'd you do this weekend? He still has autism, but he's performing at this level versus that level, and obviously, as a parent, I'm thrilled. So,
now, how is the medical profession accepting this type of method and treatment?
I actually found out about this from my pediatric gastroenterologist. So it was, recommended by a specialist.
So it's becoming mainstream.
It is becoming mainstreamed. And I offer a well baby checkup. I do a free well baby checkup. If you have concerns of your infant, you can bring them to me. I'll work on them for a half hour. And I'm doing a free children's clinic on June 20th. So, and that's for any child with special needs. If they'd like to come in and just work with me for an hour, it's all free.
Phone number and website is on the screen. If you want to contact Michelle, please do so. She is there, of course, and we'll give you all the information you need. You may need to come in and consultations probably before treatment?
No, I go right to work.
Oh.
Just like you would see this, yeah. I don't waste time.
Good, lady after our own hearts. Michelle, thank you so much for being with us. Yes.
Thank you, Graham.